Welcome to another episode from the Veterinary Medicine Digest. Today, we are embarking on a profound exploration into the intersection of physics, neurology, and emergency critical care by conducting a comprehensive examination of a singular, landmark case involving a young dog that developed status epilepticus following an electrocution injury from an agricultural fence. To understand the gravity of this incident, we must first establish a foundational understanding of how electrical energy interacts with biological systems, drawing upon a wealth of literature that spans both human and veterinary medicine. Electrical injuries are relatively infrequent in diagnostic veterinary pathology, yet when they occur, they present some of the most unpredictable and complex clinical challenges a practitioner can face. Electricity itself is fundamentally defined as the flow of electrons through a conductor. In this relationship, the force that causes these electrons to flow is known as voltage, while any material that opposes this flow creates what we call resistance. These physical properties are bound by the mathematical certainty of Ohm's law, which states that voltage is equal to the current multiplied by the resistance. When an animal becomes an accidental part of an electrical circuit, the resulting damage is influenced by several critical variables: the intensity of the current, the total voltage, the heat generated through resistive heating, and the duration of the electrical flow. In general clinical practice, electrical accidents are divided into low voltage and high voltage categories, with the dividing line typically set at 1000 volts. While high voltage accidents are often associated with more dramatic external thermal injuries, low voltage encounters can be equally deadly because they often disrupt the delicate physiological electrical processes of the body, such as the rhythmic beating of the heart or the signaling of the nervous system. One of the most dangerous phenomena associated with alternating current is the inability to let go response. When an individual or an animal touches a source of alternating current, the electricity can cause tetanic spasms in the muscles, leading to repetitive contractions that may actually pin the victim to the power source, thereby increasing the duration of contact and the severity of the internal damage. In contrast, a lightning strike represents a massive unidirectional current impulse that is much more akin to direct current. A lightning bolt can deliver a staggering 30,000 to 50,000 amperes of current, which is vastly higher than household or industrial electricity. However, the duration of a lightning strike is incredibly brief, often lasting only 10 to 100 milliseconds, which is frequently too short to cause significant deep tissue burning via joule heating. Instead, lightning and other high-voltage, short-duration shocks often cause damage through a process known as electroporation. Electroporation is a mechanism where an intense electrical field creates a massive transmembrane potential that causes the lipids in cell membranes to reorganize, forming physical pores that increase membrane permeability. When these pores form, cells can no longer maintain their essential concentration gradients, leading to an unregulated leakage of ions and eventually cell death. Because of their extreme length, nerve and muscle cells are particularly susceptible to this type of injury. Before we dive into the specific case of the canine patient, it is helpful to look at how different species and age groups react to electrical stimulus. For instance, research conducted on young mice has shown that neural sensitivity to electrical seizures changes significantly during early development. In these studies, early postnatal mice were found to be more sensitive to seizures at lower voltages compared to older mice, yet they surprisingly demonstrated a much higher tolerance and lower mortality rate when exposed to very high voltages. This suggests that the development of brain network connections and the maturity of the brainstem play a vital role in how an organism survives an electrical insult. In adult animals, death from electrocution or lightning is often the result of respiratory arrest or cardiac failure, specifically ventricular fibrillation or asystole. For grazing animals, a major hazard is the step potential. When lightning or a high voltage current hits the ground, it spreads outward, creating a potential gradient across the surface of the earth. Because four-legged animals have a significant distance between their front and back legs, they can span 2 points of different electrical potential, causing a partial current to flow through their bodies and, crucially, through their hearts. This brings us to the unique safety profile of agricultural electric fences. These fences are ubiquitous in rural environments and are designed to act primarily as a psychological barrier for livestock. They typically consist of a power source, such as a 12-volt battery or a mains connection, and an energizer that converts that power into brief, high-voltage, low-current impulses. These pulses usually occur every 1 to 2 seconds and have a duration measured in milliseconds. Because of these long intervals and the very short pulse duration, animals are usually able to step away from the fence unharmed after receiving a painful but non-lethal shock. However, the case we are discussing today highlights that these fences can be dangerous under specific, exceptional circumstances, such as entanglement. The patient was a 1.5-year-old male Kangal Shepherd dog mix weighing 62 kilograms. This dog was a trained herding dog that had been left alone with a livestock herd in a paddock secured by an electric fence. The fence was connected to a 12-volt battery and an energizer that supplied a 10,000-volt impulse every 1.5 seconds. When the owners returned after a few hours, they found the dog completely entangled in the fence. Compounding the danger was the fact that the dog's fur was soaking wet from a recent rainfall. Wet fur significantly decreases electrical resistance, while dry skin might have a resistance of 100,000 ohms. Wet skin can drop to as low as 1,000 ohms, allowing much more current to penetrate the body. It was estimated that the dog had been trapped and repeatedly shocked for approximately 1 to 2 hours before being rescued. When found, the dog was unable to stand and exhibited stiff limbs, trismus, which is a form of lockjaw, and severe hypersalivation. Upon arrival at the emergency service, the dog was recumbent and showed signs of severe tachycardia, with a heart rate of 128 beats per minute, along with panting and heavy salivation. Interestingly, despite the prolonged contact, there were no visible burn injuries on the dog's body. This is consistent with the nature of electric fence impulses, which are often too brief to cause significant thermal heating but can still wreak havoc on the nervous system. Initial stabilization measures included oxygen supplementation and intravenous fluid administration. However, shortly after presentation, the dog began to experience generalized tonic-clonic seizures. The clinical team initially administered midazolam at a dose of 0.5 milligrams per kilogram, but the seizures progressed into status epilepticus. Status epilepticus is a critical medical emergency characterized by a seizure that lasts a long time, or seizures that occur so close together that the patient does not recover in between them. As the seizures became refractory, the medical team was forced to escalate therapy. They initiated a constant rate infusion of midazolam, but when overt seizure activity returned 30 to 60 minutes later, they added a loading dose of phenobarbital at 16 milligrams per kilogram. When this still failed to control the seizures, they added levetiracetam at 60 milligrams per kilogram, followed by constant rate infusions of ketamine and dexmedetomidine. This aggressive combination finally stopped the visible, overt seizures. However, this heavy sedation led to significant hypoventilation, which was confirmed by blood gas analysis showing a progressive increase in the partial pressure of venous carbon dioxide and a decrease in the respiratory rate. Consequently, 15 hours after the initial presentation, the dog required mechanical ventilation. He was intubated and placed on pressure-controlled ventilation with a peak pressure of 13 centimeters of water and a positive end expiratory pressure of 3 centimeters of water. Given the dog's rapid deterioration and the high cost of intensive care, the owners briefly considered euthanasia. To provide better prognostic information, the clinical team decided to perform a 24-hour electroencephalogram while the dog was under mechanical ventilation. This is a critical step because of the risk of non-convulsive status epilepticus. Non-convulsive seizures are characterized by electrographic seizure activity on an electroencephalogram with subtle or no outward motor movements, often appearing only as an altered state of consciousness or coma. In human medicine, as many as 18 to 45% of intensive care patients with altered mentation may actually be experiencing non-convulsive seizures. A retrospective study in veterinary medicine has shown that non-convulsive seizures are also highly prevalent in dogs and cats with a history of cluster seizures, and these patients have a significantly higher mortality rate than those without such activity on an electroencephalogram. For this dog, the electroencephalogram was recorded using 10 subdermal wire electrodes fastened to the scalp in a standard montage covering the frontal, central, temporal, and occipital regions. During the first few hours of monitoring, the electroencephalogram revealed multiple spikes and sharp waves, confirming that the dog was indeed still in a state of status epilepticus despite the lack of visible movement. This activity gradually decreased over the initial monitoring period until only physiological background activity remained, which consisted of high voltage, low frequency rhythms typical of sleep phases. Based on these results, the clinical team was able to slowly taper the sedative and anti-seizure infusions. The dog was successfully weaned from the ventilator after 30 hours. The recovery process was slow and fraught with complications. One day after being taken off the ventilator, the dog developed a high fever of 40.3 degrees Celsius, and laboratory tests showed a significant increase in C-reactive protein and an extremely high creatine kinase level of 9,660 units per liter. This high creatine kinase level is indicative of severe muscle damage, or rhabdomyolysis, which often follows electrocution as the current damages muscle fibers and causes them to release their contents into the bloodstream. This can lead to myoglobinuria and acute renal failure, a life-threatening complication where the kidneys are overwhelmed by the filtered muscle proteins. Fortunately, with aggressive fluid therapy and supportive care, the dog's kidney function remained stable and his inflammatory markers began to decrease. By the 4th day after weaning from the ventilator, the dog began to walk with support, and by the 6th day he was standing and walking independently. He was discharged after 7 days on a regimen of oral phenobarbital. At the time of discharge, he appeared to have made a full clinical and neurological recovery. However, the long-term story takes a tragic turn. 4 weeks after the phenobarbital was eventually discontinued, the dog suffered a recurrence of seizure activity. Although the medication was reinitiated, a follow-up 2 months later revealed that the dog had been euthanized due to progressive and recurrent seizures. This tragic ending brings us to a critical discussion regarding the pathophysiology of electrical brain injury and the concept of kindling. Kindling is a process where repeated, low-level electrical or chemical stimulation of specific brain regions, particularly within the limbic system, leads to a progressive increase in seizure susceptibility until spontaneous seizures occur. It is highly plausible that during the 1 to 2 hours the dog was entangled in the fence, the repeated 10,000-volt shocks every 1.5 seconds acted as a massive kindling stimulus. This may have fundamentally altered the dog's brain chemistry and circuitry, creating a permanent state of chronic epileptogenicity that only manifested fully once the anti-seizure medications were removed. This case serves as a vital reminder for veterinary practitioners that agricultural electric fences, while generally safe, can pose a lethal risk if an animal becomes trapped. It also emphasizes the absolute necessity of electroencephalogram monitoring in cases of status epilepticus, as it is the only way to accurately detect non-convulsive seizures and guide the tapering of medications. Furthermore, it highlights that the long-term neurological prognosis for electrocution survivors remains guarded. In human medicine, survivors of electrical injuries often experience delayed neurological sequelae that can appear months or even years after the initial incident, including epilepsy, migraines, vertigo, and cognitive impairments. As we look to the future, there is growing interest in the use of neurostimulation as a way to manage drug-resistant epilepsy in dogs. Techniques such as vagus nerve stimulation, where an electrode is wrapped around the left vagosympathetic trunk, have already shown promise in reducing seizure frequency in canine patients. Other more invasive options, like deep brain stimulation of the thalamic nuclei, are being explored as well. Interestingly, even non-invasive methods like repetitive transcranial magnetic stimulation and transcranial direct current stimulation are under investigation. Transcranial direct current stimulation works by applying a very weak, constant current to the scalp to modulate the resting membrane potentials of neurons, potentially curbing the hyperexcitability of an epileptic brain. While these therapies were not applied in this specific case, they represent an exciting frontier in veterinary neurology that may one day offer a lifeline to animals suffering from the kind of progressive seizure disorders we saw in this Kangal Shepherd dog mix. In conclusion, the management of status epilepticus after electrocution requires an intensive, multidisciplinary approach that prioritizes rapid stabilization, aggressive anti-seizure therapy, and meticulous monitoring. The use of mechanical ventilation and electroencephalogram monitoring in this case provided the necessary window for initial recovery, even if the long-term outcome was not what we had hoped. This case should inspire us to maintain long-term vigilance and consider extended anti-seizure therapy for survivors of such intense electrical insults. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.